All right, everybody. YouTube, Instagram, TikTok. Thank you for joining us. We are excited to be taking care of you guys here at Deigni Plastic Surgery. So, post your comments, ask your questions. I'm here to give you all the answers for you to move forward with your body transformation, and looking forward to taking care of you. Hello, everyone. Thank you for joining us. We're going to have a lovely Q&A session this evening. I'm in Houston, Texas. Let us know where you guys are joining us from. Like Deigni Plastic Surgery, follow us. And please share the link with your friends and with anybody that you know who is actually interested in having plastic surgery done. I'm a board-certified plastic surgeon, and I practice in Houston, Texas. I specialize in body contouring procedures, so I work on the full body, including facelifts, neck lifts, fat transfer to the face, upper eyelids, lower eyelids, brow lifts. I do breast surgery, breast augmentations, breast reductions, breast lift surgery. The augmentation I do with breast implants or with fat transfer, liposuction, lipo360, BBLs, fat transfer to other parts of the body. My signature procedure is the drainless tummy tuck. I love to perform that procedure for my patients. They have a much smoother and easier recovery than the traditional way of doing the tummy tuck with drains. So go ahead and ask your questions tonight. We will be giving you plenty of information to make your journey a pleasant one. I know it's sometimes very difficult to find answers to your questions on the websites, on the internet, on different social media platforms. So go ahead, don't be shy, ask your questions. And there is a link on the bottom left of the screen there. And you can put in your information, name, phone number, email. Also a small message about what you're wanting to have done. And my patient coordinator, Linda, will reach out to you to answer all your questions and get you in for your consultation. If you are out of town or out of state, we will thank you very much, Shijama, for the gift there. I appreciate the heart puff. We will be happy to take care of you and get you on the books for your virtual consultation, and then eventually in for your pre-op visit and then your surgery. So Shijama 6 is asking, what is the weight limit? Great question. So it all depends on your height. So the number that I use is a BMI of 35. Max BMI is 35 for these body contouring procedures. And the reason being is if your BMI is higher than that, you have a higher risk of wound healing problems and surgical complications. So we definitely want to bring your surgical risk more in the acceptable range, and a BMI of 35 is my cutoff. So what does that look like? So let's say you're 5 foot tall. Your maximum weight would be 179 pounds. That's going to give you a BMI of 35. So if you weigh 150 pounds, you're fine. If you weigh 140 pounds, you're fine at 5 foot tall. If you're 5'4", your max weight will be 204 pounds. If you're 5'8", it will be 228. And if you're 5'10", it will be 240 pounds. For pricing, everybody, please go ahead and contact us. There is a link on the bottom left of the screen there. And for you guys on YouTube, just DM us, send us comments, post your comments. And on Instagram, you guys can call us at 281-724-3138. That is our phone number, and you can text us as well. So like I was saying, let's see here. And guys, please go ahead and share the link. Let's get as many people on as we can so that everybody can benefit from this information. Joe Dental 18 is asking, what's the cost? So it depends on the procedures that you want to have done. The cost can vary anywhere between $12,000 to $30,000 for a full body makeover, full body transformation surgery, depending on everything that everybody wants to put in. So please go ahead and contact us, and we'll get a little bit more information, know what you're wanting to have done, and so we can give you some estimates. And we will do are best to help guide you through the process. Pretty Black is saying mass 35 is around what weight? So it's the BMI. BMI of 35. It depends on what your height is and what your weight is to get a BMI of 35. Go online, go to Google, just type in BMI calculator, and then put your height and weight, and you'll see what your BMI is. If your BMI is higher than 35, change the weight to get to a 35, and that will tell you what the goal is for you to lose, to get to the weight that you need to get a BMI of 35. All right, so let's see here. Vicky Aiso is asking, what is the recovery time for lipo and BBL, and can I do it at the same time? Yes, you can combine liposuction and BBL. You can't do a BBL without doing liposuction because the Brazilian butt lift is you transferring fat. The only way you can get fat is by doing liposuction. So those are combined already. Yeah. Recovery time is, for most patients, usually a week. Within a week, you're back to work. You're wearing your compression garments as long as it's not any heavy lifting or anything. But you'll usually wean off your pain meds around that time. The compression garments you'll usually wear for about 2 months, and you'll switch from stage to stage. So you get your tighter garments, usually every 2 to 3 weeks. Everybody's different. But you will be getting some lymphatic drainage treatments to help contour and decrease the swelling and ease and improve your healing process. Lady 59, do you work with insurances at all after weight loss? No, the procedures that I do are not covered by insurance, so we don't take insurance. All our patients that we work on after their massive weight loss pay out of pocket. We have financing options available for them as well. We've got 4 financing plans that we offer: Patient Fi, Care Credit, Alpheon, and Cherry Financing. So definitely give us a call, and we will be happy to have you guys come in and see us and share with you all that information. When you contact us, call us, we will give you those links, and you'll be able to actually start. You're very welcome, Pretty Black. You'll be able to start your application. It's very quick. These companies will give you, especially Cherry Financing. That's the one that we really like. We see a lot more people get approved than some others who require higher credit scores. And so definitely contact us and we'll guide you through that. Okay, wonderful. All right, let's see here. We've got some good questions coming up. All right, so Joe Dental 18 is asking, what is the cost of a tummy tuck? So in general, the tummy tuck will start around $11,500, and that includes anesthesia fees, surgeon's fees, and facility fees. I do the drainage tummy tuck technique, which is a much faster and quicker recovery than the traditional one, where you have to place drains. So definitely give us a call or put in your information actually in the bottom left of the screen. That's the easiest way for you guys on TikTok, for you guys on YouTube and on Instagram. Definitely contact us at 281-724-3138. DM us directly, post a comment on any of my videos on YouTube, or just join us on TikTok. I usually do these lives every Tuesday and Thursday, time permitting, starting at 7 p.m. Central Standard Time, so Houston time. Perfect. Great questions. All right, let me get to the next questions here. Cole McKnight is saying 5'3". Okay, so your 5'3", max weight will be 197 pounds. If you're less than that, you're good to go, as long as you don't have any medical problems that would prevent you from undergoing general anesthesia. You can come and see us. We'll be happy to take care of you and get your body transformation on the way. Boss Lady 2025. I had 360 lipo. Geez, I need a tummy tuck now. Okay. Definitely contact us. We will be happy to have you come in for your consultation if you're in the Houston area. If you're not, then we'll start with a virtual consultation. So put in your information in the bottom left of the screen there, and we will reach out to you to get the ball rolling and get you in, and we'll take good care of you. So some people will go with liposuction when actually the correct plan is to have them maybe get rid of that excess skin and do a tummy tuck, but not everybody unfortunately will know, and it all depends on where you go. If you're going to a board certified plastic surgeon, they should be able to advise you and guide you as to what treatment is the best, and at least give you some warning and some kind of idea of what your results will look like if you choose one treatment versus another. I would highly recommend that you always look for a board certified plastic surgeon certified by the American Board of Plastic Surgery in the US. And the way you can quickly tell if whoever you're looking at is a board certified plastic surgeon is go to the website abplasticsurgery.org. And on the homepage, you'll see there's a big button that says, "Is my surgeon board certified?" Click on that, put the surgeon's name, and then see if their name comes up as a certified plastic surgeon. Otherwise, they are not a plastic surgeon. They may call themselves, facial plastic surgeon, cosmetic surgeon, this and that. But if they're not in that registry, they're not plastic surgeons, and they're not board certified plastic surgeons. And that is public knowledge. All right, so perfect. Let's see. Prairie Black is asking, what is your rating in stars? 5 stars, my dear. Go through all of my content on TikTok, Instagram. My rating on Google is 4.9. We had one rating from somebody who's never had surgery with me. And so I think she was just wanting to have some, I forgot what the rating was, but you can read it. You'll see that it's just baloney. But otherwise, 5-star. Yeah. Look at the reviews I have. They're very good reviews, very detailed. And you'll see what the patients, and they're very varied. And also look at the testimonials. I've got plenty on social media, patients that are, all ranges in their 30s, 40s, 50s, 60s, who give testimonials about their experience with us and how things have turned out. So, but definitely do your research. Look at our before and afters. Call us, talk to us, make sure that, and do that with anybody else that you're considering having surgery with. The other thing I want to tell you guys is, please be sure that whenever you get a consultation, that you actually get to speak to the surgeon who's going to be working on you. A lot of you guys will go to these chains of plastic surgery and never get to meet the doctor who's going to operate on them. They don't even know if the doctor is a board certified plastic surgeon. And that is really risky. I would not recommend that you do that. Okay, so Lady 59 is asking, do you work with insurances at all after weight loss? No. Like I said, the procedures that I do are not covered by insurance. We work on patients who've had massive weight loss all the time. I really love working with that patient population. I do the body lift, the body transformations, and target everything: the arms, the breast, the back, the midsection, so belly, hip, buttock area, the thighs, the face, the neck, all of it. And it's not covered by insurance. So whether you have great insurance or not, they're not going to cover these procedures. They're considered elective aesthetic procedures. So you pay out of pocket. All right, let's see here. Ruben Luna is asking, do you do BBLs? Absolutely. I love doing BBLs. So that's a combination of liposuction to harvest the fat and contour the body, and then transfer that fat by doing some injections of that fat in strategic places, usually surrounding the hips and buttock area, to really give a nice contour. So yes, we do. So put in your information in the bottom left of the screen there. We will be happy to reach out to you, get a little bit more information, and get you in for your body transformation. Share the link with friends. Let's get as many people on this live as we can. Make it very educational, and so that everybody can actually participate and get their questions answered. Marty is saying, I'm 5'8", 235 pounds. How much do I need to lose to do the lipo 360? So, or maybe the body lift, the 360 tummy tuck. So you're 5'8", 235 pounds. So you're about 7 pounds away from getting to the BMI of 35. I would prefer you lose more weight than 7 pounds, or you're pretty much very close. So that's something most people will be able to lose 7 pounds within a month. So if you're wanting to have surgery anytime before the summer, so let's say April, May, or June, by all means contact us. Or even if you want to have surgery in, over the summer, June or July, contact us now. Put in your information there. That'll be the easiest way for us to reach out to you, and we'll guide you through the process and get you in for your body transformation. All right, let's see here. Question at Lady 59. All right, Boss Lady 2025. So I had 360 lipo, now I have a FUPA. I need a tummy tuck now and lipo. Okay, so it all depends on what we see. So what is that excess skin? Where's that excess loose skin? Is it your full tummy area? Or is it just in the mons pubis area? So it all depends. So I'll be able to determine what procedure will give you the results that you want when I get to examine you. So that would be something that we could definitely take care of. Hey, thank you guys for joining us. Please leave a comment and ask your questions, okay? We'll be happy to get you in for your consultation as well. All right, let's see. So Noelia is asking, is the lymphatic massage necessary? So if you're having a drainage tummy tuck with me, you will not need a lymphatic drainage treatment. If you add in liposuction, so anybody who gets lipo 360, liposuction of the thighs, the arms, then yes, I will want you to get lymphatic drainage treatments, because that really helps to decrease the swelling in the areas where I do the liposuction, and it decreases the time for you to actually recover. So that will really help with your recovery process as well, in addition to putting appropriate garments on for the compression. But if you're doing just the drainless techniques of the tummy tuck or the body lift, you don't need lymphatic drainage treatments. And we will discuss this in great detail over your consultation, either in person or virtually. All right, let's see. Kia, do you know how to work around a lap band? Yes, I've operated on patients with lap bands and given them some beautiful tummy tucks and body lifts. So if you're interested in having surgery with us, by all means, give us a call or put in your information in the bottom left of the screen there, and we will take care of you. Joyonce, I'm in Houston. I need you. Wonderful. Come and contact us, okay? That's our phone number, so call us during business hours, 9 a.m. to 5 p.m., or put in your information in the bottom left of the screen. That's the easiest, because then we get your phone number, your name, your email, and we can reach out to you and book your consultation with us, have you come in to see us, and then we'll get you on the books for your surgery. Wonderful. Excellence. Okay, so let's see here. Just browsing. I had a tummy tuck and liposuction 360 2 years ago. Now I have an upper stomach. Do I need lipo? It all depends on what exactly is there. So I can't answer that question until I actually examine you and see you. I need to palpate your skin, your fat, your areas. I need to see what is there so that I can provide the appropriate treatment. If it's excess skin, we need to remove skin or do some skin tightening. If it's excess fat, then we need to do some liposuction. But I can't discuss that or tell you what you need without examining you. So definitely come and see us, and we will be able to discuss the various treatments and see which one's best for you, okay? All right, Marty, 5'8", 235 pounds. How much do I need to lose? Okay, I think we answered that question. Yeah, to do the 360, 5'8", 235, you need to lose another 7 pounds. So you're very close. So within a month, you should be able to lose that weight. That's a safe weight loss rate for you. So definitely come in and see us now, and we can start booking your surgery for the next month or two, whenever you're wanting to go forward. Miss Brocas, this is one fine. Oh, thank you very much. I appreciate the comment there. Thank you. Thank you. And trusted phrase too. Thank you. I appreciate it. Like I said, I do these Q&A sessions live for you guys to, one, get the information that you need to be able to move forward safely with your surgeries, whether you choose me or not. We hope that you do choose us, but whoever you choose to go with, please use this information that you get. The other thing is to make sure that you're seeing the correct person. So board certified plastic surgeon, go to the website that is public knowledge, check and see if the person that you are selecting as your surgeon is actually a board certified plastic surgeon. This is public knowledge, so you have to do a minimum. It's very easy and it's available, but you have to do your due diligence. Make sure when you do get a consultation that you're not just talking to an assistant or a patient coordinator. When you do your consultation for your surgeries and getting a treatment plan, you need to be able to speak to the surgeon who's going to be operating on you. These are very, very important parts of getting the right treatment plan. Okay, so let's see here. Pretty Black is saying, what you said the name of the company you should go through for the credit that is not, oh, it's cherry financing. So come and see us, or put in your information in the bottom left of the screen there, or call us 281-724-3138 during business hours, 9 a.m. to 5 p.m. Houston time, so Central Standard Time. And we'll give you that information, and we can actually run the application. The other thing I like about the cherry financing is it's a soft check on your credit, so it doesn't actually bump or negatively impact you if you don't get accepted. So it's a very quick way to give you an idea of how much you'll be able to get that done. Oh, okay, so beyond, Joyanne says 12K is out of my budget. Sure, understandable. For a tummy tuck, like I said, I have a lot of patients who will put their money aside and save. It may take them a year. It may take them a little bit longer. Some have been following me for about 2 years, and they've been saving regularly, and then they've come in to get their surgery done. Or they get also part of it financed by one of those 4 companies, and then the rest of it they do with whatever they were able to save. So where there's a will, there is a way. Just start saving if this is something that's very near and dear to your heart, and you will get it done. Absolutely. All right, so let's see here. Okay. So good question by Babs. Can I have liposuction in my arms without removing skin and still look good? It all depends on what you look like. So this will be determined on physical examination. So specifically to you, I can't speak to, but I can say that I've done liposuction to other patients in their arms without removing skin, and it looks fantastic. So if you've got good quality skin, you don't have stretch marks or things that are actually going to show that your skin is not going to contract appropriately, we don't have to do the arm lift with the skin removal or the skin excision with the scar. So for example, tomorrow, I've got a patient. I'm going to be doing a wonderful mommy makeover on my patient. We're going to be doing liposuction to the arms. But if I only do liposuction to the arms, she's going to have a lot of loose skin that she's not going to be happy with. So we're going to do a combination of liposuction with the skin excision procedure. So she's going to have the scar that goes from the elbow in. She wants to have nice contours, and she's okay with the scarring. Now, not everybody wants scars, so there are definitely limitations if we don't do the skin excision, but we can always also use, thank you very much for the gift there, I appreciate that. But we also give the skin a little bit of a boost to contract by using J-plasma or Renuvion energy. So perhaps in your case, we will be wanting to do that. I don't know. I'll be able to determine that when you come in for your consultation. I can palpate, examine you, see where the skin is, where the fat is, how much we have, what the skin quality is, and we'll be able to do that. Okay? Perfect. And again, put your information in the bottom left of the screen there, and we will be happy to take care of you. Also, share the link. Share the link with your friends and let us know. Let them know that we are live and able to answer your questions and take care of you. Joe Quinto, thoughts on all therapy? I have not done all therapy, so I don't really have much to say about that. Let me just look quickly. about what that is. So that's micro-focused ultrasound energy to stimulate collagen production. So I stay away from ultrasound type of energy. I prefer radio frequency energy. There is much less risk of actually burning somebody. So I don't do all therapy. I do radio frequency therapy. Let's see here. You're very welcome. You're very welcome, everybody. Thank you for participating, and thank you for answering other people's questions as well. So let's see, Marty, for some reason, this is like the third time I see your question about weight loss, but or your BMI. All right, so do you do constructive surgery? Do you mean like reconstructive surgery? Is that what you're referring to? I'm not sure. Just ask which surgery it is that you're interested in doing. It depends on what type of surgery you're referring to. So I do what is called elective aesthetic surgery, cosmetic surgery. Some of those procedures that I do will fall into a reconstructive type of surgery, depending on what has been done before, if we have to do revisions, things like that. But we don't take insurance. Insurance doesn't cover it. So it's still elective. Let's see here. Back lifts. Yes. T. Simone. I do back lifts. Absolutely. So patients who come in who've got some back rolls, a lot of loose skin, especially if you've lost a significant amount of weight, 60 plus pounds, 100 pounds, 150 pounds, you may have a lot of loose skin around your body, and you are not happy with the bra line rolls that you see. I would do a back lift for you as well. Yes, definitely. So put in your information in the bottom left of the screen there. We will be happy to take care of you. You're very welcome, Pretty Black. Definitely happy to be able to provide this information and ease up your search and help you move forward. Thank you very much, Tropical Exotic Treats. You're always gifting us those roses. Much appreciated. And looking forward to taking care of you when you come in for your procedures. Let's see here. Okay, good question by Babs. Can you do any lipo with just numbing and no general? Yes, you can. However, you can't be as aggressive. So it all depends on how much liposuction you want, where you want it done. And because at some point, we will exceed the amount of anesthetic that we can put in before it actually affects your heart. And we definitely don't want you to get a heart attack, have kind of a stroke or any problems just for removing some fat. So definitely at a certain point, it will be a lot easier, safer, especially for you to just go under general, for us to do big areas of liposuction. To get aggressive with the liposuction and sculpting, it's a lot more comfortable to be under general anesthesia. So let's see here. I don't understand this question. Let's see here. All right, so let's see. Rona Minamam Amarnan. What's the recovery time for tummy tuck, BBL, and the cost? Cost is probably anywhere between $15,000 to $20,000, depending on what needs to be done exactly. But definitely give my office a call, and we will give you the cost. I know the tummy tuck starts around $11,500, and anything that would change that depends on if we need to do an extended tummy tuck, if you had previous surgery that has a lot of scarring, and so it changes the length of the surgery, which makes it a little bit more complicated as well. And then it increases the pricing, especially for anesthesia facility. So those are kind of like the variables we kind of look at. But starting price is $11,500 for the drainage tummy tuck. When you add liposuction, BBLs, it will go higher. But that's kind of like the general way that we do it. So give us a call, and we'll be happy to give you some estimates so that you can start budgeting. Now, talking about the recovery time. So when I do my tummy tuck, I do the drainless technique. It makes your recovery process a lot easier and faster. Most of my patients will wean off their pain meds. When you combine it with the BBL lipo, they'll wean off their pain meds usually by 7 days. Everybody's different. Some may need longer, maybe 10 days, but definitely within that second week. So you come to see me for your first post-op appointment, usually within that first week. Some patients will be off their pain meds by then and just take maybe occasional Tylenol as needed. Some others may need pain medication for that second week. By then, they're going back to work. Usually, you'll get back to the gym, usually around 2 to 3 weeks, just doing light aerobic activity, walking and things like that. And then back to the gym, actually doing resistance training around 6 weeks, light, start light, and then increase. By the time you get to 2 months, you're full workouts with no restrictions. All right, let's see here. All right, thank you everybody for participating. I appreciate that. I've been on this live 3 times and my questions never got answered. I answered your question, Kia. I'm not sure which other question did you post that we haven't answered. Hey, Miss Fuller. How's it going? 163. All right. Misty, there you go. Hi, Dr. D. Thank you. Thank you for participating. I appreciate it. Hope you're doing well. Brianna Shante is asking, do you do just J plasma? I do Renuvion energy-based. Yes, that's the only energy-based device that I use. Yes, I don't use any other devices. That's for skin tightening when I do invasive. When I don't do invasive, then I'll use ThermiSmooth radiofrequency treatment on the skin to rejuvenate. For vaginal rejuvenation, I'll use the Thermiva, which is the radiofrequency treatment to stimulate collagen rebuild and actually help with stress urine incontinence symptoms for our patients, and also offer the O-shot to help out with any kind of sexual decrease in orgasms and things like that. Just the whole vaginal rejuvenation package we do. So definitely we do use other radio frequency energy-based devices. So the Thermi family, and then the Renuvion J Plasma. Swanky Chick Nazir, if your pressure goes low, what happens? I'm not sure in what reference that is, but if you're having general anesthesia and your pressure goes down, the anesthesiology team will adjust your pressure so that your pressure is within the normal range that we want. So they'll give you some medications. Okay, yes. All right, let's see here. Misty Fuller 163. We should do a live or show my tummy tuck before and after. We should, definitely. You've got some beautiful, beautiful results. And I'm very excited that you love your results too. So if you're able to go live, we can always do that. Or what we can do is when you come in the office, I'll be happy to do an interview, like a session when we talk. We sit down, talk, and then if you want to show your beautiful results, we'll be able to do that as well. And I'll probably post that not only on TikTok and all the social media platforms, but I'll also put it on YouTube. I'm trying to get more active on my YouTube channel as well. So, but thank you. All right. Here's a comment by Love Live Laugh 24x7. Chile, just go to the DR. Be very careful whenever you travel out of the country for surgery. Do your due diligence. We have a lot of people who have come back from the DR or Mexico or other places who have had some horrible experiences. We had some people who've lost friends and family members in those places. So I'm not saying that there aren't good surgeons there, but please be very careful. Do not go by price. It is not worth you shopping on price. You're not going to, get a wardrobe change. This is surgery. You want to be safe. And by all means, do your research, do your due diligence, be safe, and make sure that whoever's going to be operating on you is qualified to do the surgeries to give you beautiful results and get you through your body transformation safely. At the end of the day, it is your body, it is your money. You can go wherever you want. Unfortunately, like I said, we've had a lot of people who've come in for revisions to see us, who've had surgery in the DR, Mexico, other places, and people who have told us very sad stories where they've actually lost people that they went with as well to have surgery. So please be very careful. There's always going to be people who are going to be giving you cheap surgery. And I just say, you get what you pay for. Do not gamble. Of course, this is surgery. There are some times where there's going to be complications, there's going to be some problems, but you want to make sure that you're able to actually get the care that you need. And that the surgeon who you choose that you choose to work with is actually going to be there to help you through those difficult times. Rare precious jewel. Hello. If I was to fly in, how long would I need to stay for BBL, lipo, and tummy tuck? Great question. So we get people that fly in all the time. You will stay usually for about a week. Some patients will stay for 2 weeks. They have family and friends that they want to stay here with, and so they'll extend their stay. But the quickest turnaround time for that type of procedure has been about a week, give or take. So definitely contact us. Put in your information here on the bottom left of the screen. There should be a form that you can fill out. Name, phone number, email, and also let us know what procedures you're interested in. You already did. So you just put BBL, lipo, and tummy tuck, and we will reach out to you to get a little bit more information. We'll start your medical file. You'll be able to send us your pictures, fill out your whole medical history. This will all be done through your patient portal, which is HIPAA compliant, and we will get the ball rolling. Diana Godinez. Is there an age limit for skin removal? There isn't. I've operated on patients in their 50s, 60s, 70s, and they have done extremely well. So the main thing is how healthy you are. So it's not really your age, it's your overall health. There may be some people who are in their 40s who are not healthy enough to undergo these procedures, whereas you can have some 70-year-olds who are extremely fit, healthy, and they can undergo these procedures without any problem. So I don't focus on your age, I focus on your overall health. But great question. So please go ahead and contact us. If you would like to have some type of body contouring procedure, so a skin excision, it could be, for the arms, the inner thighs, it could be around the waistline, so a body lift, which combines a tummy tuck, a montplasty, which is the fupa area that I always fix when I do my tummy tucks, a hip lift, and a butt lift. That will really help to remove all of that excess skin that's around your belt line. Tiffany, I'm 4'11", 158 pounds. Wonderful. Would I be eligible for 360 BBL, chin lipo, and arms? You would qualify BBL-wise. Yes, you will be at a less than a 35 BMI. So definitely come in and contact us. Contact us and then come in for your consultation so we can take a look at you. And I think you will be, eligible for all of those procedures at once. Yes. Wonderful. Wonderful. As long as you don't have any medical problems that will prevent you from undergoing these procedures. Yes. Now, if you have high blood pressure, anemia, diabetes, things like that, we have to make sure that these are medically optimized so that we can have you go through these procedures safely. So, Kia, I've answered your question. Do you know how to work around a lap band? Yes. I've operated on patients with lap bands. If you're wanting to have your surgeries done and you have a lap band, by all means come in and we'll be taking care of you. Okay, good. Okay, maybe TikTok is slow because it's like I see your question being repeated so many times when I've already answered it. So I don't know why, but now I'm seeing that, yes, you see that I answered your question. So again, if I miss your questions, please be patient. I think maybe sometimes TikTok, just doesn't show things or they remove things. So I'm trying to do my best to answer everybody's questions. I'm here for you. to educate you, answer your questions, facilitate things. So if I miss your question, please don't be offended. Just contact us. We're very happy to answer your questions, give you the information to guide you through the process. And then we hope that you'll choose us to come in to have surgery with us. And all of this is to make you comfortable. So a lot of patients that come in from the TikTok community, I love my TikTok family, they come in and they are very comfortable during the actual face-to-face consultation because they've been following us for so long and have gone through all of the content and are very happy and comfortable with the information. And so please go ahead and ask your questions, okay? What about lipo for the neck area? Nick W504. Yes, I do liposuction around the neck to help remove any of that excess fat that could bother you. If you have a double chin, things like that, and you're not really happy with it, definitely neck liposuction is something that I do. Put in your information in the bottom left of the screen there, and I will be happy to get you in for your consultation. Well, Linda, my patient coordinator, will reach out to you. She'll get some information from you, and start your medical file. If you're out of town, out of state, we will start with a virtual consultation. You will be able to upload your pictures, fill out your medical history through your patient portal, and then I'll be able to actually review that before we meet virtually so that we're going to have a much more productive consultation. Rana, meet a mom, our mama. Let's see here. Do you recovery area for out of state? So do we have a recovery? Okay, so for the way I do the procedures for my patients is to make your recovery as easy as possible. You do not need skilled nursing to be able to recover from these procedures. What we require is that you have an adult with you if you travel. Now, if you're coming by yourself, then yes, we will make some recommendations for you to go to a recovery home so that you can recover at least for one night for the first 24 hours, if not then for 2 days. But then after that, you should be able to actually start taking care of yourself by yourself. So most of our patients will go to an Airbnb or a hotel, or if they have friends and family in the Houston area, they'll stay with them. So that's typically how they recover. But absolutely, we have recommendations for recovery homes if that is what you're interested in. And we will go through all of that during your preparation for your consultation. And definitely once you've had your consultation, we start preparing you for your surgery. We'll go through all the logistics, all of that information so that you're well prepared and ready for your surgery. Oh, so you heard. Had myomectomy, I don't have children. Would a tummy tuck or liposuction be better for the abdomen? It all depends on whether you have excess loose skin or just excess fat. So we will be able to determine that when I examine you and palpate your belly, do the exam, see what's going on, and then we can determine whether or not you would benefit from liposuction only, or a combination of liposuction with a tummy tuck, or just a tummy tuck. So that's something that I'll be able to answer when you come in for your consultation, so I can actually examine you. It's impossible for me to know and answer that question without seeing you. Carissa Young Sullivan, I need a lot of skin removal all over. How many places can you do at once? Great question. It all depends on how much fat and skin is there. Typically, we stage these procedures to do no more than 6 hours at a time. So for patients in your case who've had massive weight loss, have a lot of loose skin, right? Most of them will say, I need to take care of my whole body. So they'll have a lot of loose skin in their arms that they don't like. They have deflated breasts. They have long sagging breasts. They have a lot of skin around the beltline area that goes belly, hips, back, right? And lower back or buttock. They also have a lot of loose skin in their thighs. It goes all the way down to their knees. So those are big surgeries that I need to do. Typically, I will separate the arms and legs. So that's at least 2 different surgeries. Depending on how much we need to do, we can probably do all of that in 2 surgeries. Otherwise, it's going to be 3. And I've had many patients who've come in, and we usually do it within 2 or 3 stages, because and each stage is about 6 hours long. That's typically how we stage these procedures and get the treatment plan done. So you tell me kind of like which areas are most important to you, what you want to get done first. The majority of people will want to treat their belt line first. So I want to do a full body lift, which is a hip lift, butt lift, and during this tummy tuck. And in some patients, we may be able to combine that with the breasts, or do that with the arms. It all depends. But it's probably 2 or 3 different surgeries. Mahogany, can you please answer my question? Okay, let me look for it and see where it is in the feed, and I will answer it. Also, you heard, I'm now 179 pounds and 5'4". My BMI is 31. Congratulations. Excellent. So with that BMI, you will qualify for me to actually move forward and operate on you. So please contact us. Put in your information in the bottom left of the screen there, and we will be happy to take care of you. Beautiful. 5'10", 175. Perfect. Perfect. You would definitely qualify BMI-wise. So please give us a call, or put in your information in the bottom left of the screen. Let us know what surgeries you're wanting to have done, what areas of your body you want to get taken care of, and we will be happy to move forward. Ebony Doll, I'm not sure if you've answered this already, but do you perform Lipo360? Yes, I do. I do Lipo360 as well as fat transfer. And we can do the fat transfer to the hips, the butt. We can do the fat transfer to the back of the hands. I've had some patients come in who want some rejuvenation of their hands. I've done some where I do the fat transfer to the face to rejuvenate the face as well. I do fat transfer to the breast for those who want more volume to the breast but don't necessarily want implants. And I've also done fat transfer to the labia majora to help with the whole vaginal rejuvenation process for mommy makeovers. So it all depends on where you want that placed. Bree, once you do the full tummy tuck, how long does it take to get the feeling around the belly button? It depends. Everybody's different. It could be anywhere from up to 9 months to a year. It takes time for those nerve endings to start growing back. So give it some time. All right, so let's see here. So Mahogany, I don't see your question, so please retype it and it will hopefully come back in the feed. But if I see it, I will pin it and answer. Let's see here. Jack Smith, 601. Hi, I am 5 foot tall, 169 pounds. What height should I be to get a tummy tuck? Oh, I think you mean probably what weight. That's fine. At 169, you'll be less than the BMI of 35. So that's okay for us to move forward. However, my answer is you want to be within 10 pounds of your goal weight. So if your goal weight is, say, for example, 155 pounds, then I would ask that you lose another 9 pounds, and then we can move forward. However, if you're comfortable at this weight or you're comfortable at 160 pounds, then we can move forward with the tummy tuck. So give us a call or put in the information in the bottom left of the screen there, and we will be happy to take care of you. All right. Monica is asking, do you perform any work under local anesthesia? I do, but it's only in select patients and it depends. So I'll do, for example, upper eyelid surgery, eyelid lift under local anesthesia. It's a fairly straightforward process. Most patients are okay with that. I'll do earlobe repairs. I'll set back ears If you have prominent ears that stick out, I'll do that under local anesthesia in the office. I will do removal of lipomas, which are fat collections that bother people. I'll also do labiaplasty. I will do scar revision, dog ears, all of that under local anesthesia, and also do some breast implant removal as long as there's no capsular contracture or ruptured implants. Those are things that I can do under local anesthesia. Typically, and I'll do a mini tummy tuck. That's another one, but very select few patients will qualify for a mini tummy tuck. So there are procedures that we can do under local anesthesia. All right, let's see here. Thank you very much, everybody, for your questions and for participating tonight. I appreciate it. Hopefully, you guys are getting some valuable information, and we look forward to taking care of you. User long number. I am 5'3", 224 pounds, and also had a gastric sleeve. What weight loss is needed for surgery? Okay, so if you're 5'3", 224, your max weight should be 197. So you have about 30 pounds to lose. And that's typically, we'll say, you want to lose around 8 to 10 pounds per month. So that should give you about 3 to 4 months to be able to get to your weight, where that will be at a BMI of 35, which is the high end, the cutoff. So if you can lose even more than that to get you safer in that BMI zone, then we'll be happy with that, and we'll be able to move forward with surgery for you. Okay. Getty1209, hi. Would you say that getting any bariatric surgery before tummy tuck affects the outcome of a tummy tuck? So if you're wanting to have bariatric surgery, it's because there's an indication. So you'll probably need to lose a significant amount of weight. And so getting that bariatric surgery will be able to help you to lose that weight. Now, if you're able to lose the weight without bariatric surgery, then that's even better. But a lot of people are not able to lose that weight without the surgery. So that's why they get the bariatric surgery. Now, as far as does it affect the results of the tummy tuck? It all depends on whether or not you're able to actually have, correct any medical problems like vitamin deficiencies, anemia, so iron deficiency, or let's see. Usually, if you're able to lose that weight, whether it's with bariatric surgery or just diet and exercise, if you have high blood pressure, type 2 diabetes, it tends to correct that either way. So that would be fantastic. But the outcome of the tummy tuck, not necessarily, unless you have, like I said, a electrolyte deficiency or a nutritional deficiency from the bariatric surgery, then you should be fine. Jessica Lid, yeah, Dr. Deigni is awesome. Thank you. I'm very happy with my procedure. I had it done in 2023. Thank you so much. That's 2 years ago. And thank you so much for participating and sharing your experience with us. I appreciate it. Hope you're doing well. Let's see here. Let's see. What other questions? All right. Thank you, Miss Monica. I highly recommend Dr. Deigni. I will be getting my procedure done tomorrow morning. Yes. And thank you for joining us live. Tomorrow we're going to film. And if it's okay with you, we're going to do something when I'm marking you. And maybe you can tell, the crew, the TikTok family, and we'll post it on Instagram and YouTube as well, what procedures you're having done and kind of like your experience has been so far. And of course, I'll be doing the regular filming during the surgery as well, saying what procedures we're getting done. And then we'll also follow up after with your experience as well. So perfect. Yay. Get some good rest tonight, okay? All right. And don't forget the medication you take tonight before, the only one will be your gabapentin, okay? Wonderful. If you forget, no big deal. Don't worry about it. It's not a big deal, but definitely, yeah. Okay, tropical exotic street trees is actually, is Miss Linda back? She should be back. I think today she should have returned from her vacation. So she was on vacation last week, through the weekend, through yesterday. So she should be back today. She'll definitely be back in the office working tomorrow. So definitely you're able to contact her tomorrow, okay? And she should be able to get back to you. Okay, let's see here. Okay, Aguila is asking, good evening, doctor. With the new technology, is there any way to fix my loose skin without scars? It's a good question. It all depends on how much loose skin you have, sorry, and where it's located. Some patients, I'm able to do the J plasma renewable energy skin tightening procedure, and that actually treats their loose skin. Others, they have so much loose skin that it's not going to treat it effectively, but it definitely will help. So if you really don't want to have those scars, those big scars, we can do it. It will help. It's just not going to get you to the point where, we could get you if you did the full surgery. Again, surgery is the gold standard. All of these other procedures are trying to mimic what surgery does. So as long as you understand the limitations, I'm okay with moving forward with the energy-based devices to get you as close as possible. All right, perfect. So please go ahead and put in your information there in the bottom left of the screen, and we will be able to take care of you. Eagle Eyes Forever. I'm interested in new to this world. What is body contouring? Oh, definitely. So body contouring is reshaping your body, and it involves many different types of procedures. It could be invasive, surgical, non-surgical procedures. So typically when I talk about body contouring surgery, it's liposuction, fat transfers, a BBL, which is a Brazilian butt lift. It's surgery after massive weight loss, so removing excess skin, such as the drainless tummy tuck, the body lift, which it combines the fupa area where I fix it, doing a monsplasty, the tummy tuck area, the drainless tummy tuck to fix the belly area, the hip lift and butt lift to really help with the whole belt line. It involves improving your contours around your thighs. It could be just liposuction or a thigh lift where I actually remove excess skin and fat. Arms, face, neck. That's what body contouring is. So I'm glad you're interested. Please go ahead and like Deigni Plastic Surgery, follow us, and contact us too. Put in your information in the bottom left of the screen there. We will be happy to take care of you. Other things that we do in addition to the surgical procedures is also help women with vaginal rejuvenation, with stress urinary incontinence if you have it. So if you're coughing, sneezing, or participating in some type of, dancing activity or tennis or whatever activity you're doing, yoga, things like that, Zumba, but you start leaking urine, it could be embarrassing. So what we do is treatments to help improve that urinary continence. And that's Thermiva treatment that we do in the office. There's no anesthesia, no downtime, no recovery time. It's very quick in the office, usually a 30-minute procedure. And those are all types of procedures that we do to help people. Vicky Ayisu is asking, what is the recovery time for chin lipo? It depends if you're getting chin lipo only or not, but typically, if say you're only getting chin lipo, it will usually be 1 to 2 weeks. You'll wear a compression garment, chin strap for that amount of time. The swelling will go down, bruising will go down, and usually by 3 weeks, you're kind of at the stage where things are looking nice. You'll probably have a little bit of swelling here and there as you continue to heal over the next couple of months, but overall, it's a fairly quick recovery. Okay, Melissa 1981 is asking, do you do BBLs? Yes, I do. Absolutely. So definitely contact us, put in your information in the bottom left of the screen there, and we will be happy to take care of you. Let's see here. Tropical Exotic Treats is asking, where can you find other board certified drainless tummy tuck surgeons? I don't know. There aren't that many surgeons that do the drainless tummy tuck procedure. So Board certified, definitely you'll see, like I said, if you go to the American Board of Plastic Surgery website, you'll be able to know whether or not the surgeon you're selecting is board certified. And as far as like the drainless tummy tuck, that's really hard because there's not that many plastic surgeons plastic surgeons are the ones that do the tummy tucks. And so I don't even have to say just surgeons in general, but plastic surgeons, there aren't that many that do the drainless technique. So I don't know how you would go about it. I guess you have to go through the website to see if they offer it or call their office and ask them. But like I said, I do only the drainless technique. I think it's a much better technique for everybody. Naleen 339, I'd like to schedule a consultation Thursday morning. Okay, so wonderful. This Thursday probably won't be possible, but we can definitely do it next week because this Thursday I'm actually traveling to Austin with Linda. We're going to the aesthetics meeting. It's our annual conference. So we'll be there Thursday through Sunday. So we won't be able to accommodate appointments on Thursday morning. So please go ahead and contact us and we'll be happy to have you come in as soon as possible. But definitely give us a call. We will be in the office in the morning, so it all depends. So I don't know if this is a situation where you're in town just for that specific time. So it depends. We may be able to accommodate. But if you're in the Houston area, we can just we can schedule you next week Thursday if that works for you. Twinkle Me 8, I'm interested. Perfect. All right. So put in your information. Okay. So you said you're 5'5", 200 pounds. 5'5", 200 pounds. You would qualify for that BMI of 35. So we will be happy to actually take care of you. It depends on what you want to get done. How much? It depends on what procedures you want to have done. So the tummy tuck, the drainless tummy tuck starts at $11,500. But mommy makeovers usually will range anywhere between $15,000 to all the way up to $30,000, depending on what you put on, what procedures you want to get done. So for my patients who had, pretty much the full body transformation, their quote is usually around $28,000 or $30,000, and that's when they want everything done. So, but if you want a few things done, your quote will be adjusted, of course, based on your specific treatment plan. But give us a call, and we'll be happy to take care of you. Okay. Can I get another tummy tuck? My first one, they did not tie my muscles area, and will it hurt? Oh, okay. So if you have diastasis recti, so separation of your muscles, yes, we can revise your tummy tuck and then go ahead and fix that separation of muscles. Now, you're saying, is it going to hurt? The majority of my patients wean off their pain meds usually within 3 days. 3 to 5 days from surgery, they're off their pain meds. They're walking upright. And if you've had the tummy tuck with drains, then I guess you'll be able to compare whether or not your recovery is actually better. Of course, doing the muscle tightness, that's why I actually inject Exparel medication to help relieve that discomfort from the muscle repair. But like I said, the majority of my patients will wean off their pain meds within 3 to 5 days, walk upright, come and see me. A week after surgery, typically they're driving themselves into the appointments and they're back at work after that first appointment. Some go back to work even sooner. Yes. So, okay, Creative Brandy is asking, although you do virtual consultation, do you also meet the patient prior in person as well? Absolutely. So I will see you 3 times before we do surgery. And there's plenty of other places where you don't even get to meet the surgeon, even on the day of surgery. So please do your research. I will meet you in person, well, virtually, I guess, the first time if you're out of town and out of state or out of the country or not able to travel to Houston to get your consultation. So we will meet virtually. When you come in before surgery, we always have our patients come in before surgery. So a day or 2 before surgery, we will meet in person. I need to be able to examine you, palpate your tissues, make sure everything's good, make sure that the treatment plan that we decided is good to go. Then I will also see you the day of surgery. So you'll see me at least 3 times, 1 virtually, 2 in person, before we go forward with surgery. Absolutely. And then, of course, you're seeing me after for your post-op appointments and follow-ups. Okay, let's see. Suzanne Sobers, 929. Hey, I am 184 pounds with a 5'2" height. What should be my weight? So at 184, being 5'2", you will be just below that BMI of 35. You would qualify for me to be able to do your surgeries. Now, ideally, like I said, I tell my patients, I want you to be about 10 to 15 pounds from your ideal weight. So if, for example, you would like to be at 170 pounds, I want to ask you to lose about 5 more pounds before we move forward with surgery, which is easily doable within a month. So say, for example, you wanted to have surgery next month or in May, come in and see us now. We will start the process, get you on the books, save your date for surgery. During that time, you lose your 5, 10 pounds. You're good to go, and we can move forward. So put in your information in the bottom left of the screen there, and we'll be happy to take care of you. All right, let's see. How overweight does a person have to be for bariatric surgery? I was right. Well, you would have to ask the bariatric surgeons. I'm not a bariatric surgeon. The general surgeons who specialize in bariatric surgery are the ones who do these procedures. I know that patients who've had bariatric surgery typically will do it so that they can actually lose 40, 30, 40, 50, 60, 70. Some will lose 150 pounds. I've had some people who've lost 200 pounds. So it all depends on how motivated you are. So if you're really motivated and you say you need to lose 30 pounds, if you're very motivated, you should be able to lose those 30 pounds within 4 to 5 months. However, not everybody's able to do that. And so sometimes they will need to get bariatric surgery. But again, those are questions that the general surgeon who specializes in bariatric surgery will be able to answer, discuss with them, and guide them. Okay? All right. Ramona 64 is saying, hello, I've had weight loss surgery. Now I have sagging skin. Okay, good. We'll be happy to take care of you. I operate on patients who've had weight loss, who have a lot of sagging skin, and we're happy to do your body contouring procedures and help you get a much better contour. So please go ahead and contact us, and we'll do that for you. Twinkle Me 8 hip dip fillers. So to correct the hip dips, what I do is fat transfer. So in your case, what I would do is some liposuction to remove the fat from areas where you don't want it. And then I will fill those hip dips with that fat. It's a much better, long-lasting solution. Now, if you do fillers, you're talking about hyaluronic acid fillers. Depending on how much filler you need to put in, it could be very expensive and probably even more expensive than the surgery. And over time, that filler is going to break down and you're going to need to do some more. So be very careful as to how you select your procedures, your treatment plan. So if you've got the fat, I always tell my patients that it's better to actually transfer that fat there because it's going to give you the best long-term results than having to do fillers. Okay, so Quiet Storm 2313. I need to make an appointment for a consultation. Perfect. Put in your information in the bottom left of the screen. There should be a form where you can put your name, phone number, email, tell us what procedures you're wanting to have done, and my patient coordinator, Linda, will reach out to you and give you all the information and get you on the books for your consultation. Thank you very much for the gift. I appreciate it. All right. Jeanette So is asking, hello, how long does a BBL take to do? It depends on the patients. Some patients give up the fat a lot easier than others. But in general, a BBL will be around 3 hours of surgery time in general. So it's the same day procedure. You go in, leave the same day. Jessica Rodriguez is asking, does J-plasma work on loose skin on the back of the legs? It all depends on how much loose skin you have. So J-plasma will work for a certain amount of loose skin. If you have too much loose skin, it really won't do what surgery can do. So it all depends on what you look like on exam, how much loose skin you have, what needs to be done, and how much of a correction you want to get. Creations by Lorena 510. Do you take insurance along with payments? No, our office does not take insurance. The procedures that I do are not covered by insurance. Everybody pays out of pockets. And we offer 4 payment plans, financing plans, cherry financing, Alpheon, Care Credit, and Patient Fi. Go ahead and put in your information in the bottom left of the screen there. We will reach out to you, talk to you, and answer your questions and get you in for your consultation. Hey, Jackie Marie, how you doing? Hope all is well in Louisiana. Wonderful, wonderful. Okay, let me get to you guys. You're very welcome. Yes, it is. Excellent, excellent, excellent. Okay, so Redhead, yeah, I'm saying, sorry, I just got in. Do you perform rhinoplasty? I do very specific rhinoplasties, just mostly removing the hump of the nose. Otherwise, I send my patients to rhinoplasty experts. So what I recommend is that you go and see, especially if it's going to be a lot of work, tip work, very involved rhinoplasties. You want to be seeing somebody who does that day in and day out, and that's all they do. But for me, I do the cases where I actually just shave the extra cartilage to remove the hump, the dorsal hump. But otherwise, I would say see a rhinoplasty expert. Noelia, do you have appointments in the afternoon? Yes, we have appointments in the afternoons. I see patients on Mondays and Thursdays, and we see patients morning and afternoon. This Thursday, we're going to be out of town because we're going to our annual aesthetics meeting, and we're very excited about that, so we can learn what the latest techniques are and also get to mix and mingle with plastic surgeons from around the world. We do get a lot of international plastic surgeons that actually come to these conferences, so it's going to be a lot of fun to meet, see different techniques, and definitely brush up on our skills and make sure that what we're doing is fantastic. So definitely contact us. Next week, we'll be happy to get you in for your consultations, either virtually if you're not in the Houston area, or in person. Myra Cruz, can the body lift and arm lift be done at the same time? It can, and I've done it on multiple patients. So we can definitely do that. And that would definitely tax the whole 6 hours. Sometimes it's 7 hours, depending on what we have done. So for example, well, actually, tomorrow's not a body lift. It's a tummy tuck with liposuctions and arms and then lipo 360. But kind of a close combination, but not quite the same. But yes, we can do a body lift and arm lift at the same time. Yeah. Noelia, 4'11", 147 pounds. Yes, that would be good. You will definitely qualify BMI-wise for us to be able to move forward with surgery. So please go ahead and contact us. Put in your information in the bottom left of the screen there, and we will take care of you. Wonderful. How much is the body lift with the arm lift? For pricing, please go ahead and contact us. I don't have the pricing with me. The only price I know is my signature procedure, which is the drainless tummy tuck, and it starts at $11,500. So for combining the hip lift, butt lift, and arm lift, is going to be more than that. How much? I don't know, but we have to take into account the timing, because facility fees, anesthesia fees increase with the length of surgery. So we have to take all of that into account. My patient coordinator, Linda, will be happy to give you an estimate so you can start budgeting, and then we'll get you on the books for your consultation and for your pre-op appointment. Dee, can I get BBL tummy tuck 360 lipo with herniated bulging discs, height loss L45 S1? Yes, you can. It depends on what limitations you have with these bulging discs. If you're not having any issues walking, pain, and things like that, if all of that stuff is good, you can move forward with these procedures. Yes, and we'll be happy to have you come in for your consultation and take care of you. All right, I am going to be wrapping this up very shortly. I do have to get some rest so I can get ready for my big case tomorrow. Let's see here. Okay, so Jack Murray saying, at Sophie, I had tummy tuck and lipo and I had no pain. He is amazing. That's wonderful. Everybody is different and heals differently, but I'm glad you had no pain. I was very pleased. And I know that you were very apprehensive about the pain, but you did extremely well. So let's see here. With chosen 1988, with the tummy tuck, do you also do lipo? I saw your correction there, to define the waistline. So the tummy tuck is a procedure on its own. Liposuction is a procedure on its own. If you want to combine both, absolutely we can do it at the same time. But my tummy tuck does not include liposuction, just as my liposuction does not include a tummy tuck. Those are two separate procedures, but we can combine them. Absolutely, and I do that all the time for patients who want to have the definition there. Let's see here. Okay, so let's see here. Myra Cruz, I did bariatric surgery and I dropped 36 pounds and feel like I need a body lift. And what is the cost? Okay, so for cost, again, please contact my office and we will be able to give you that information, okay? Lost skin elasticity, my legs and my behind dropped. Is there surgery to fix that issue? Yes, so I'll have to examine you and see what the best treatment is for you, but we can definitely see which procedures will be done. Myra Cruz, why don't you read my questions? I just answered both questions, so hopefully I got all that taken care of. Like I said, it all depends on when it actually shows up on my feed. So, mom of Huskies, where are you located? We're located in Houston, in the River Oaks area near the St. Regis Hotel. So give us a call. That's our phone number, 281-724-3138, or put in your information in the bottom left of the screen and we will take care of you. I'm done. Just noticed I said Houston. Don't worry, you're not the first one. A lot of people ask the same question and it's right here. No worries, no worries. And we'll be happy to take care of you, okay? When having factor V lining, can I have a drainless tummy tuck? That's a great question because it increases your risk of blood clots. That would be a question that we have to do in conjunction with the hematologist and see if it's safe for you to actually undergo this procedure. Can you do giveaways for mommy makeovers? No, we don't do any giveaways, but we always give good pricing for everybody. So please go ahead and contact us and we'll be happy to take care of you. I was asking about the bottom upper lift. So come in for your consultation. I'll be able to see what your body is like and then come up with the appropriate treatment for you, okay? J. Rowe, I'm 5'4", 177 pounds, looking for lipo 360, thigh lift, and an arm lift. Can this all be done at the same time? I would say no. I typically separate the thigh lift and arm lift because it is a big recovery for my patients. So I typically, without seeing you or knowing how much you have to get done, I would probably separate it. However, if you only have a little bit of excess skin, in fact, that's mostly in the upper part of your thigh, then yes, I should be able to combine all three procedures for you. So come in and see us, and once I examine you, see how much needs to be done, where I need to put the incisions, I'll be able to let you know if I can do all three at the same time. Okay, so put in your information bottom left of the screen there. That's the easiest way to do that. Okay, let's see here. For those having difficulties traveling, do your associates in South Florida you could recommend? I don't have any associates at all. I operate by myself. I'm the sole plastic surgeon in Deigni Plastic Surgery here in Houston. But I'm sure you can go online and look for plastic surgeons, board certified plastic surgeons around an area if you're not able to travel to Houston. We get plenty of patients that come in from South Florida to have their surgeries with us. But if specifically for you're not able to, I would say just do some research and look for board certified plastic surgeons in your area, and then do your due diligence. Really look at their the websites, call their office, talk to them, and make sure that you're comfortable with their care their before and afters and things like that. Christy, I'm 5'6", 147 pounds. Can I get skin removal? Yes, you will definitely be able to qualify BMI wise, as long as you don't have any other medical problems that will preclude you from having the skin removal surgery. We will be happy to have you come in and we'll take care of you. Absolutely. So please put in your information in the bottom left of the screen. I will be finishing this live very shortly. So if you're not able to put it in right now, definitely go to Deigni Plastic Surgery to my profile page and click on the get quote form, put in your information, and we'll reach out to you. And thank you for following us. I appreciate it. All right. So I think I've answered pretty much as many questions as I can. I'm sure there's some more questions. And I apologize if I haven't gotten to your question tonight. Please know that I do these live sessions every Tuesday and Thursday, time permitting. I won't be able to do one this Thursday because I'll be traveling out of town, attending a conference. And so I'll be back doing live Q&As probably definitely next Tuesday. I'll see if I can drop in some time, maybe during a conference at some point. We'll see if I get some free time. But I appreciate everybody following us. Thank you very much for your questions. Like I said, contact us and come and see us, and we will be happy to continue to give you information, help you navigate these body contouring journeys, and I'll take care of you, okay? So examples from getting skin removal, anything like high blood pressure, type 2 diabetes that is uncontrolled, anemia, things like that, anything that will pretty much make you not a candidate to undergo general anesthesia at this time. We need to medically optimize you and get you safe, okay? Thank you very much for participating, Noelia, and everybody else. God bless you and have a wonderful night. Bye-bye. Attends, mais